As the widening coronavirus outbreak stokes fears of a worldwide pandemic, it's worth remembering that the 1918 Spanish flu pandemic may have started in Kansas, and it hit Kansas City particularly hard. Lessons from that time still resonate today.
It's always a good idea to remember your history so you don't repeat those mistakes,
says Susan Sykes-Berry, a retired nurse and librarian with the UMCK Health Sciences Library who wrote a graduate thesis about the 1918 pandemic flu in Kansas City.
In 1918, a new respiratory virus jumped species from animals to humans, spread throughout the world, infected probably about 1/3 of the world's population. It killed between 50 and 100 million people, which if you adjust for population, that would be equivalent to 225 million to 450 million people today. The overwhelming majority of those deaths occurred in a very brief period of probably about 14 to 15 weeks. I'm John Barry. I'm a writer. Wrote a book, among others, called The Great Influenza, the story of the deadliest pandemic in history. I'm also on the faculty at the Tulane University School of Public Health and Tropical Medicine. This was not ordinary influenza by another name. People could die in less than 24 hours after the first symptoms. That wasn't common, but it definitely happened. Some of the symptoms were horrific. In fact, it was initially misdiagnosed as everything from cholera, typhoid, dengue, which is referred to as breakbone fever, to give you a sense of those symptoms. People could bleed not only from their nose and mouth, but from their eyes and ears, which is pretty horrific and terrifying. When public health authorities are saying this is ordinary influenza by another name, the public knows perfectly well that they were being lied to. And I actually think that when you come right down to it, society is based on trust. And without trust, society is going to begin to break down. And that's actually what happened. I mean, the lies were so extreme in Philadelphia at a time when the city was digging mass graves. Priests were literally driving horse-drawn carts through the street, calling upon people to bring out their dead. One of the Philadelphia newspapers said, quote, "This is not a public health measure. There is no cause for alarm," unquote. I mean, how stupid did they think people were?
Some researchers say the 1918 flu outbreak, the deadliest pandemic in history, may have started in Kansas. A Haskell County doctor is believed to have first documented the deadly flu strain, and it is believed that soldiers from Haskell County transported the disease to Fort Riley. Camp Funston at Fort Riley was particularly hard hit, and then U.S. troops sent from Fort Riley to fight World War I in Europe may have carried the virus with them and spread it from there.
In February 1918, a doctor in Haskell County, Kansas, named Loring Minor, reported seeing a spike in patients with the flu.
Loring Minor noticed a population that he was servicing was getting sick, and very sick, with an influenza unlike any he had ever seen before. He considered it so serious, he felt the need to alert the U.S. Public Health Service to this.
The previous spring, in April 1917, the nation had declared war on Germany and joined World War I. In Washington, D.C., President Woodrow Wilson needs more troops as fast as possible. John Barry believes that one of those new soldiers was an early carrier of the disease, who may have helped spread it more widely. His name, Albert Gitchell.
The first identified patient to report sick was very early March 1918. He was a cook.
Albert Gitchell is a typical American doughboy, an ordinary enlisted man. Every region of the country is producing soldiers for the war effort. 20% of the soldiers are immigrants. They speak probably 100 different languages in the military camps. This is a real snapshot of where America is at that moment.
Gitchell reports for duty at newly created Camp Funston in Kansas, just hours away from the outbreak in Haskell County. He's a member of the 164th Depot Brigade, supporting other recruits. He puts his butcher skills to work, feeding hungry mouths.
His job is basically to touch the food that hundreds or thousands of soldiers might eat on any given day.
But that March, Gitchell falls suddenly ill. Burning throat, aching body, fever of 103. He lands in the infirmary. Within hours, more than 100 other soldiers report identical symptoms. 46 men die. It's a serious outbreak. No one has any idea that the disease will soon steal across the United States, and that what is happening on an Army base in Kansas is about to bring the nation and the rest of the globe to its knees.
The first cases of influenza in Kansas City, Missouri, developed among the city's 2 Army Motor Corps schools, and from there spread to the civilian population. On September 27th, local newspapers reported that the commandant of the Motor Corps had placed the 2 schools under a strict quarantine after it became apparent that the few cases that had developed among trainees several days earlier had now become a serious outbreak. Nearly 1,000 student soldiers in the 2 corps now had the disease. Simultaneously, 3 young civilian women living at the girls' clubs showed symptoms of the disease after having visited one of the Motor Corps several days prior. Reports of additional civilian cases circulated, but the official stance of the Kansas City Department of Health was that these civilian cases were only severe colds. If only it were true. Kansas City was about to experience a deadly influenza epidemic. Within a few days, the number of new cases, both at the Motor Corps school and within the city's civilian population, started to climb. By October 1st, 20% of the city's Army training schools had contracted influenza. 43 civilian cases had appeared, with 33 of them under isolation. Kansas City Health Director Dr. E.H. Bullock now acknowledged that his city was on the cusp of an epidemic, but noted that it was not yet dangerous. A week later, as more cases developed, Kansas City Mayor James Cowgill declared influenza a public emergency under the city charter, granting the Board of Health the authority to open hospitals, enforce health regulations, and make necessary expenditures. The board reacted immediately. On October 7th, it ordered all schools, theaters, and churches closed and prohibited gatherings of more than 20 people. Liberty Loan mass meetings were included in the ban, but planning luncheons were permitted as military necessity. Saloons and cabarets were not ordered closed, but would be watched closely by health inspectors to ensure that they did not allow more than 20 patrons to congregate at a time nor become a public health menace. Kansas City shuttered itself as best as it could against the impending storm. The orders were not implemented as smoothly as they could have been. The problem was leadership. In most cities, decisions about how to best run the anti-epidemic campaign were left to the health officer, some of whom were guided by Influenza Advisory Board or by a health board. In Kansas City, however, in addition to Health Officer Bullock, the Director of Contagious Disease Department, Dr. A.J. Gannon, also took a leading role. The 2 men clashed immediately. On October 8th, Gannon ordered the Metropolitan Company, operated of Kansas City's streetcar service, to limit the number of standing passengers on its cars to 20 people. The company's president refused to comply, arguing that conductors did not have the legal authority to implement such a rule. Gannon then asked the police to enforce the order. Health Director Bullock and several members of the Board of Health, including its president, Dr. W.P. Motley, refused to support Gannon, however, and countermanded his order. Bullock told Gannon the passenger limits were unnecessary and that the president of the Metropolitan Company had complained that his company was being persecuted. Gannon responded that he was going to have his inspectors examine every streetcar anyway. Board of Health President Motley then chimed in, stating he would not support Gannon's inspection or his passenger limit order, adding that the police were only needed when there were riots or civil disorder.
Until such conditions exist,
Motley stated,
we will go ahead ourselves enforcing the city ordinance without the police department's help. We're not going to cause the streetcar company any trouble in this matter.
Later that day, Gannon's inspectors reported streetcars not fit for beasts, let alone human beings, and ordered some 14 cars sidelined until they were properly cleaned. Dr. Gannon did not stop there. That same day, he sent inspectors to survey each and every saloon in the city. They found all of them to be insanitary. Gannon ordered police to close saloons unless they were sufficiently cleaned that night. The next day, Gannon ordered to close all secondhand stores and pawn shops dealing in clothing, as well as all cleaning and dyeing shops found to be unsanitary. He claimed that many stores had received clothing from Camp Funston, where the epidemic had started particularly early and had been especially severe. And although he had not been able to trace the epidemic to secondhand clothing, he believed it contributed to the spread of the disease. Within a few days, Mayor Cowgill, Health Director Bullock, Dr. Gannon, and other members of the Kansas City Public Health Administration began to discuss the possibility of lifting the closure order. New cases were being reported each day, but these men believed that the epidemic had reached a plateau. Captain A.A. Hobbs, Chief Medical Officer of the city's 2 Army Motor Corps training schools, strongly disagreed, arguing that influenza was still prevalent in all sections of Kansas City, and citing the Army's requirement that epidemic measures to be kept in place for a minimum of 3 weeks to be effective. The head of the local chapter of the Red Cross, as well as one of the members of the Board of Health, agreed with Captain Hobbs that it was too early to lift the closure order. Nevertheless, Mayor Cowgill and Dr. Gannon believed that the danger had passed. Effective at noon on Monday, October 14th, the closure order and gathering ban was lifted. The Board of Education met shortly thereafter and ordered Kansas City schools to reopen the following day. Had Mayor Cowgill or Dr. Gannon listened to Captain Hobbs or taken time to read the news and other cities' experiences, they would have realized that the epidemic had not ended so quickly in any community in the United States. Kansas City was in for a much longer and much bumpier ride. Dr. Gannon was too busy condemning stores, apartment buildings, and even whole neighborhoods as unfit for humans to notice the influenza danger. When the Chamber of Commerce called for a meeting with local physicians and members of the Board of Health to discuss the raging epidemic, Gannon replied it was
no longer necessary to hamper business by a continuance of the ban. The responsibility of preventing its spread should be assumed by the individual.
Public fear, he added, would keep people from gathering. Fear, however, was not an effective public health measure. Apparently, garlic and onions were, as Gannon claimed, responsible for the lower numbers of influenza cases in Little Italy. On October 17th, after an emergency meeting with the Board of Health, Mayor Cowgill announced a second closure order and gathering ban. The order went into effect immediately, once again closing all theaters, churches, and schools. Unlike the first order, the gathering ban now applied to dances, parties, weddings, and funerals as well. Hotels, cabarets, and restaurants were barred from having music or other amusements. Stores employing 25 or more employees could not open before 9 a.m. nor close after 4 p.m., and crowding in city stores and shops were forbidden. Lastly, all cases were to be isolated within their homes, placed under quarantine. Kansas City had finally gotten serious about its epidemic. Businesses and residents lived under these restrictions for the next month as new case tallies spiked, then dropped. By the first week of November, it appeared as if the danger had truly passed. Merchants and other business interests, along with at least one council member, began to pressure Mayor Cowgill to remove the closure order and gathering ban. Cowgill himself supported removing the ban, believing that the latest rules imposed by health authorities were ineffective and unfair to Kansas City's businesses.
Business has borne the burden of the epidemic too long,
he told the public. The Board of Education was eager to reopen classrooms, but opted for a cautious approach. The closure was causing students to fall behind their curriculum schedule. The empty school buildings were costing the city approximately $10,000 per day. Still, the Board of Education believed that the comparative low numbers of influenza cases among the city's children was the result of the school closure, and therefore opted to keep the classrooms shut until all signs of danger had passed. Within a week, however, as new cases dwindled to a trickle, the board decided to reopen the schools on Monday, November 18th. On November 26th, local newspapers reported the latest influenza bombshell. The Board of Health had removed Dr. Gannon from his position as director of the Contagious Disease Division of the Health Department. Board members were quoted as saying, in addition to his brash demeanor and his proneness to making unilateral decisions, Gannon had been submitting inaccurate cases tally reports since at least mid-October, often reporting only half the number of actual cases. The president of Board of Health, Motley, commented that he was glad to see Gannon go, and that he had been in favor of his removal for well over a month. In the meantime, Kansas City epidemic had begun to spike again, particularly in children. On November 30th, Health Director Bullock announced that schools, still on break for the Thanksgiving holiday, would remain closed until further notice. The next day, he announced that the closure might last through upcoming Christmas holiday. Having lost so many days to the previous school closures, prospects for a carefree summer of outdoor play now seemed bleak. So did their current situation, given that parents were asked to keep children under 16 years of age at home, and movie houses and retailers agreed to bar youngsters from their premises until the epidemic had finally abated. By the time the remaining days of the year arrived, Kansas City's influenza epidemic situation had improved drastically. New cases and deaths continued above the normal seasonal rate throughout January and February of 1919, but nowhere near the numbers reported during the height of the epidemic. Schools reopened on Monday, December 30th, the last day of the epidemic control measures to be dropped. The new year came, and residents celebrated as best they could. For some, the worst had passed, as they can look forward to a better year. For those who had lost loved ones, however, the difficulties of coping with the losses had only just begun.
Turning and turning in the widening gyre, the falcon cannot hear the falconer. Things fall apart, turning and turning in the widening gyre, mere anarchy is loosed upon the world. The blood-dimmed tide is loose, and everywhere the ceremony of innocence is drowned upon the world. The best lack all the blood-dimmed tide is loose, and everywhere the ceremony of innocence is drowned. Surely slack revelation is at hand. Surely the second coming is at intensity. The second coming. Earlier those words out at hand. When a vast surely the second coming is at hand. Troubles my sight. Second coming. Earlier turning and turning in the widening gyre. The falcon cannot hear the falconer.
What can we learn from the influenza epidemic in relation to today's coronavirus current situation? Lesson 1. Politics matter. In a 2018 interview with KCUR's Central Standard, Susan Sykes-Berry, retired nurse and librarian, said Kansas City was hit very hard by the 1918 flu because of politics. The beginning of the outbreak was reported by the Kansas City Star in September 1918. It raged until spring of 1919. Sykes-Berry said the city was divided in its response between public health advocates and followers of Tom Pendergast. The Board of Health ordered schools, theaters, and churches closed, but business owners resisted.
Tom Pendergast controlled saloons, she said. When they did finally get around to putting a quarantine, saloons were exempt. They just let them stay open because nobody wanted to challenge Tom Pendergast. In addition, other business owners and managers of streetcars didn't want streetcar riderships limited. It was a business decision.
While schools closed in Kansas City, Kansas, the order to close schools in Kansas City, Missouri was lifted in October 1918. The epidemic spread more rapidly in Kansas City, Missouri. There was no vaccine and no good treatment, but Sykes-Berry notes some approaches worked and are still relevant today.
The best treatment you can get was nursing care. In the Visiting Nurses Association, they have records that show that they treated 2,300 some people, and they only had 35 deaths in that number.
Lesson 2. The quarantine worked.
St. Louis had a very strict quarantine, and St. Louis had about half of the death rate that we did.
Sykes-Berry told KCUR.
Kansas City, Kansas, and the whole Kansas side, they had a better response because they weren't politically divided.
In the end, Kansas City had experienced a long and hard influenza epidemic. From its start in late September 1918 through early spring 1919, over 11,000 cases and over 2,300 deaths occurred as the result of the epidemic. As a result, Kansas City experienced an excess death rate of 580 per 100,000 people, placing it among the hard-hitting cities in the United States. While 1918 still resonates, the good news is that Kansas City and the world have seen tremendous advancements in medical approaches since then. Researchers are already working on a coronavirus vaccine, and the clinical trials should start soon, although it may not be widely available for many months. So, between good hygiene and social distancing, what we can learn from 100 years ago can help get through another pandemic.